I'm Dr. Rebeca Gracia. My background actually started in pharmacology. So I went to pharmacy school, but I consider myself more of a recovering pharmacist. I never aligned with the concept that was taught in pharmacy school, and so immediately afterwards I pursued additional training. I did a 2-year fellowship in toxicology with UT Southwestern at Parkland, to where I had a lot of hands-on experience with acute toxins, environmental toxins, and worked with adult and child populations. This is really what introduced me to the real world of toxins that are out there that aren't going to be found in textbooks, that aren't taught at regular medical schools. And so that piqued my interest into seeing the types of symptoms that clients were experiencing day in and day out that didn't really have an answer. So that led me to continue my research and work, and I did a National Institute of Health patient-oriented research program and did additional research training looking at how our medical society really develops programs, really develops the drugs and the protocols to help people achieve better health. And after that training, I ended up opening my own compounding pharmacy, which I developed all natural, organic types of products, and found that the majority of patients out there are dissatisfied with the current medical field, with their pharmaceutical medications. They find that they take the advice, they take the medications, and they're still sick. They still feel bad. And so then I started training with more of the holistic, natural practitioners out there that actually got answers, actually had real live stories and case histories of patients and families who went through health journeys together and were successful. Patients who were cancer survivors, patients who walked away from their diagnoses. And this is where I found that I belong. This is where I'm very interested in helping people who may have already tried the conventional side of medicine. I've been there, I have that training, I understand how it works, but I also see that it doesn't work well for everyone. And so for clients who are interested in improving their health, whether it's just their energy level or whether it's with a specific disease in place, I can work with their practitioners. I do a series of different types of scans to investigate really the root cause of the imbalance in their body. So I do a computer-regulated thermography, it's a CRT, usually called a thermogram. This is different from a camera thermogram in that it looks at the function of all of the internal organs. This is kind of the baseline, gives me a roadmap to come up with an action plan to see what your body needs to do to balance. After the thermogram is done, we can identify your next steps and, if needed, do some deeper scans. There's a DICOM that is a frequency-based scan that can look individually at organs or at the body overall to see what the root cause of inflammation is in the body. I'm also trained and work with the Zyto company doing the scans and EVOX, which is an emotional balancing. So I believe that your body is physical, spiritual, and emotional all together. So you really want to be able to address all three of those facets of health in order to reach your goals. I personally have a wonderful success story with my family. My oldest daughter was diagnosed with autism when she was younger, and with the thermogram, with wonderful practitioners that have been led to our life, we've been able to identify what was causing the irritation and help lead her out of that. And so now she's happy and successful and has started her own career as an artist. And I'm very excited to be able to share her success story with other families out there as well, just to let you know that there is hope. There is a way. If we keep on looking, we'll find a way to find what your body needs to heal. Everyone's different. You need an individualized protocol. It's not one set prescription type of protocol that works. Your diet needs to be individualized, the lifestyle choices, the products and the doses. So I have a wonderful group of practitioners that I work with, utilizing their expertise really to help you come across the answers that you need. That's what people are looking for. They have symptoms, they know something's going on with their body. So I'd love to be able to help you along your journey and find the answers that you're seeking.